That means that there's a 3.4% chance I'm going to damage my kidneys by taking this drug. I'm talking about statin drugs. It's a $19 to $20 billion business. It's not good for us. It's really good for the people that are making $20 billion. But these are drugs that don't help us whatsoever and, in fact, are very toxic. Here's what the literature has to say about these drugs. Number one, they ruin your muscles. Number two, they can cause peripheral neuropathy and other forms of neuropathy. It can cause cognitive impairment. It can cause heart failure. It can cause cancer, depression, pancreatitis, type 2 diabetes, which is interesting because doctors love to give statin drugs to patients with diabetes. I guess not knowing they make the diabetes worse. It can induce insulin resistance and finally can cause violence in women. These are all published side effects of statin drugs. That would be okay, probably, because in medicine, we look at this thing about where risk and benefit. So if you got this much risk of a drug, but you have a huge benefit and the benefit outweighs the risk, you could kind of make a case for doing the drug. But these drugs have no benefit at all. Zero. Nada. I'm going to show that to you. So if you hang with me, you'll understand this. We're going to get into some detail on this because I don't think a lot of lay people, certainly doctors, don't know this. So hopefully there's some doctors listening to this podcast to learn a little bit about it. One of the things that statin drugs can do is damage your kidneys. Now, this is a particular problem because patients with heart disease are often given these drugs, and patients with heart disease can often have compromised kidney function, and diabetics are frequently given these drugs, and diabetics can have kidney problems as well. In this particular study, they compared two statin drugs. Now, all the statin drugs do the same thing. Okay, there's a bunch of them. They all do the same thing. They wipe out that enzyme that I was talking about that is so important, so critically important to the way the human body works. It needs the cholesterol it makes. We need cholesterol. It's absolutely critical for the function of the adrenal gland, the sex glands, the brain, the immune system. We need cholesterol for that. That's why we make it. We don't have to depend on eating it because it would be dangerous to do that. So our bodies were designed to make this stuff, and it's the most abundant steroid in the human body is cholesterol. So if it's the most abundant steroid, might be a little important. Maybe you ought not to be knocking it down. Well, maybe you could. You can make a case for knocking it down if, in fact, it did some good. But we're going to talk about in a later post about the fact that it doesn't do any good at all. We've all been sold a bill of goods that is absolutely false. But in this particular study I want to talk about right now, they looked at two different statin drugs, and they looked at 152,000 plus men and women who were on one of the drugs and 795,000 men and women on one of the other drugs, and the average age is 68 years old. Basically, what they found was that one of the drugs, there was a 2.9% increase in kidney damage, and in the other drug, it was a 3.4% of the people had kidney damage from the drugs. That's a lot of people. Like that 4%, that 3.4% increase in kidney damage, that means that there's a 3.4% chance I'm going to damage my kidneys by taking this drug. Now, the gist of the article was, hey, don't take the one that causes the damage 3.4%, take the one that causes the damage 2.9%. That particular reference, if you want to look that up, is called the association of rovastatin use with the increased risk of hematuria and proteinuria. And you can find that in the literature.